Study designs are broadly classified into observational and interventional studies. Observational studies are further classified into descriptive studies and analytical studies. Descriptive studies involve describing key characteristics of the study sample. They include case reports, case series, cross sectional descriptive studies, and longitudinal descriptive studies. In a case report, the researchers describe one case in detail. Common reasons for writing a case report include rarity of the diagnosis, unusual presentations, rare side effects, diagnostic difficulty, or management difficulty. Examples of a case report include case report of olanzapine induced diabetes insipidus and schizophrenia, diagnostic and management challenges in a patient with juvenile onset Parkinson's disease. In a case series, the researchers describe 3 to 10 cases with similar diagnosis or characteristics. They often highlight the similarities and differences in the cases presented. Examples include case series of outcomes of 5 patients with clozapine induced agranulocytosis and diagnostic challenges in 4 patients with neuroleptic malignant syndrome. In cross sectional descriptive studies, the researchers aim to estimate the prevalence of a health outcome in the target population. Examples include determining the prevalence of systemic hypertension among healthcare professionals, refractive error among school students, chronic obstructive pulmonary disease among smokers, Helicobacter pylori infection among patients with peptic ulcer disease. In longitudinal descriptive studies, the researchers aim to evaluate the incidence of a health outcome in the target population. Examples include determining the incidence of diabetes mellitus in the general population and aggression among psychiatric inpatients. Take, for example, a study in which a group of researchers wanted to determine the prevalence of depression in patients attending a primary health center. They recruited 250 patients who attended a primary health center and collected the demographic and clinical information. They then administered the Patient Health Questionnaire 9 (PHQ 9) to determine whether each patient had depression or not. They evaluated the study participants at a single time point and no follow up was done. This was an observational study as the researchers simply observed the outcome and did not provide any intervention for the purpose of the study. Since the researchers measured the prevalence of the outcome, that is depression, in the target population, that is patients attending a primary health center, the study design was described as a cross sectional descriptive study. Now, consider another study in which a research team wanted to estimate the prevalence of medication non adherence among patients with type 2 diabetes mellitus. They recruited patients with type 2 diabetes mellitus from the diabetic clinic of a tertiary care hospital. After obtaining the basic demographic and clinical details, they measured medication non adherence in these patients using medication adherence rating scale. The assessment was done in one sitting and no follow up was done. This study was an observational study as the researchers simply observed the outcome and did not provide any intervention for the purpose of study. Since they measured the prevalence of the outcome, that is, medication non adherence, in the study sample, which included type 2 diabetes mellitus patients, the study was described as a cross sectional descriptive study. Thank you.